think one of the issues that comes through very clearly in the research that we've done with patients is that they don't really understand the role that opticians play. They tend to associate going to the opticians with having their vision tested and being given spectacles or contact lenses if they need them. They don't really understand that the optometrist carrying out a sight test is looking at the health of their eyes too. So I think what we discussed today was the value in practitioners actually thinking more about how they can promote eye health, which is really going to be for the benefit of patients, particularly given the strain there is within hospitals and the need for more care to be provided in the community.
I think the thing that's changing in terms of the healthcare delivery or the job of the optometrist, in the old days it was you used to see a problem and refer it. It's now more incumbent upon the practitioner to actually manage what they can and probably to also manage diagnosed disease. So a lot of the patients that I see now are what we would term step-down patients from hospital. So they may have been diagnosed with glaucoma, be considered to be low risk, and are now being managed in a community setting. And certainly when it comes to the minor eye condition services that have been developed, we're now seeing patients in the community and treating their condition, and often that treatment is very, very simple, but it's saving the health economy quite a lot of money because it's reducing the numbers of referrals into secondary care.
So again, I think it's really important that optometrists are not just there and have this perception of them as just refracting or selling glasses. They're actually there to look at the whole health of the patient. They do a good background history, medications. They do refract the patient, but then they look at the eye, and there's so much you can tell on the surface of the eye. And so yes, we look at not just the glasses, but we look at the overall health of the eye and manage people. And it is a positive message. It's something that you can do to help your patients, and I bet you patients will be thankful. They are going to be there. They're going to know that you didn't just sell them a pair of glasses. You went and you cared about them, and you solved a problem that they may not even know that they had, but you've actually solved something that they thought was normal, but actually now they can live their lives without the sore, gritty, dry eye sensation permanently. Patients buy into that. I think it'll improve your brand loyalty and loyalty to you as a person and to your practice. So I think it is really, really valuable that we look at not only just refracting, but also the general health and promoting good eye hygiene, good eye health.
Well, I think an optometrist has got to make themselves approachable. They've got to be friendly. They've really got to go the extra mile, welcome their patients to the practice, make the patient feel important, make the patient feel relaxed. And if all of those things happens, you can then get a nice exchange of information, and patients can be managed really, really effectively.
Yeah, I think there's a couple of things. I think we have two ears and one mouth, and we should use them in those proportions. And what do I mean by that is we should really listen actively to the patient in the chair. There's a really good discussion about proactive recommendation of contact lenses, but I think that the insights that came out of that discussion about really properly listening to what people tell us about their lifestyle, but really importantly, then relating back your recommendation to their lifestyle, personalising the advice. For me, that's a sign of a good clinician, but secondly, I think it gives you a much better chance of that patient acting on your advice because they've related it to something that's important to them.
Well, I think there's no doubt that there is reluctance among certain groups of patients to come and see their optometrists. They are worried about maybe what might be found as a result of an eye examination. And I think it's up to the optometrist to communicate really well that they've found good, healthy eyes, and to reinforce that's the point of coming in to have their eyes checked.